The UDN has been really incredible to me. As was mentioned, I'm a patient of the UDN, and this is my second year that I've been able to participate in PEER. PEER is an patient advocacy panel made up of 8 patients that have been through UDN. And for 2020, I've had the opportunity to be one of the co-chairs. The patient advocacy portion of PEER is not comprised of any medical professionals. And because of this, on PEER, we do have some privacy laws that restrict us from having unsolicited direct communication with UDN participants. So PEER communicates to UDN participants in two main methods. The first is that we prepare and send out a quarterly newsletter that the UDN assists us and sends on our behalf. That is currently circulating to just over 1,500 recipients. The second way is that we also moderate a Facebook group that's specifically for patients and families of the UDN. Of course, the patient or family needs to join the group before we have communication with them. So they're opting in. We currently have about 385 members in this Facebook group. To prepare the information and data for this presentation, we were limited on time to be able to present it in the quarterly newsletter. So we gathered our information through a survey that we made available to the Facebook group. If you want to go to the next slide, we've got some of the results from this survey. So to no surprise to any of us, a large majority of participants that completed the survey have had their UDM process interrupted by the COVID-19 pandemic. What was interesting is that we still did have about 29% that felt like their process had not been interrupted due to the pandemic. About 7% said that they were able to finish all of their testing prior to the pandemic's onset, but that some of the behind the scenes things such as genetic testing and things like that has been delayed. Next slide. We also asked a couple of additional questions, such as which specific part of their UDN experience has been, affected by this. And we did have about 14% that completed the survey that said that their UDN visit or their clinical visit was either canceled or delayed. 22% said that their test results were delayed. And then others said that they did have their visits done by telehealth instead of in person. We did ask for other, and some people did submit some of their own information. That had to do with the further testing, reanalysis on an ongoing basis of genetics sequencing and things of that nature. Next slide. We asked how they felt like their overall experience with telehealth has been with the UDN. And I thought that this was pretty good. There was 28 or 29% that felt like it was very neutral. So they didn't have anything bad or resoundingly negative to say about it. And then some felt like it just wasn't super applicable to them. A couple of things that was interesting when we reached out for some additional comments from some people about what they have liked or disliked about telehealth visits is, and you can go to the next slide on this one. Some felt like there was a feeling of disconnection from their provider. They felt like they were not able to adequately express their thoughts or their concerns with their provider. Some cases where there is a need, has not to date been a specific physical examination possible. Now they've been able to do it through telehealth, but not in person. Speaking from my experience with my UDN visit in 2018, it did rely very heavily on the physical examination and then also a muscle biopsy that was done in person. So that would have been drastically affected there. Others felt like that their general experience with telehealth overall has been positive. They felt like that they get as good, if not better, engagement with their provider. And as has been mentioned before, they felt like it was very efficient. As an example, one said that if you have 30 minutes scheduled for your telehealth visit, you generally get all 30 minutes. There's no waiting around in waiting rooms or anything like that. They said that they didn't feel like that was always the same with in-person visits. Some did feel like it was impersonal, which is to be expected when there's getting to know each other and things like that, but that they were very appreciative of the opportunity for telehealth because it was information that they felt like they would not have been able to get otherwise during this time had it not been for telehealth. So again, UDN as a part of Peer, we do reach out, try to communicate with patients as often as we can. And this was some of the feedback that we received through a survey that we prepared through the Facebook group.